I'm Sara Krzyzaniak, so I know I see a lot of friendly faces here in the crowd. But for those of you that don't know me, I'm at Stanford, the program director there, and I'm going to talk with you guys about learning theory and education theory. And this is something that I will say, as someone that sort of had a slow trajectory into medical education research and a medical education career, I didn't have a lot of formal training. I was actually a psychology major, so there's a part of me that felt like this should be intuitive. And I think that I found this disconnect that was like I could know a theory, I knew what a theory was, but the application to how I would use it in medical education was really challenging for me. So several years ago, I started really wanting to take a little bit of a deeper dive into education theory and understanding how we can use it as medical educators. And so I hope to give you some of that today, just a short 20-minute lecture, but hopefully just to review how we can be using this. So 3 objectives. I want to just talk about what is the role of learning theory in medical education. Hold on, I can't see my slides on here. No, I just need to move this down so I can see my own without having to read it this way. Oh, perfect. We'll talk about how we can use learning theories in how we design theories or scholarship, how we design curricular innovations that we're doing, and then just talk about how we can implement some of these changes using what we've learned about learning theory. So you guys heard about scholarship already. So we know that there's different types of scholarship. There's scholarly teaching, right? That's like this practice that involves like wisdom and having an expert that can help teach and using, it's very teacher focused and the effectiveness of the teacher. But what I want to talk about, again, you've talked about dissemination, we've talked about promotion. But I really want to talk about how we disseminate our work. And one of the reasons why scholarship doesn't get published, or when you submit something, is the lack of a conceptual or theoretical framework. And so what I would really love is that the papers that we start presenting have a phrase like this in it. The model is founded in 3 theoretical perspectives: humanism and person-centered approaches, informed or self-guided assessment, and the science of behavioral change. Right, so if we could all just have like a little paragraph like this when we explain why we're doing a research, or why we did a research project, why we asked a question, right? We should be able to say something like this. I think intuitively, we're all great educators. We sort of get why things work and why things don't work. But when we talk about wanting to submit it for publication, we have to have that common shared language. We have to be able to communicate why did we do something beyond just, I had a hunch it's going to work. So it's hard to give a talk about conceptual frameworks or theoretical frameworks without just mentioning this landmark paper. So this paper from 2020 really tried to break down the difference between theoretical framework, and conceptual frameworks. I will tell you, I have read this paper multiple times. Every time I go to redo this lecture, thank you, right? Every time I go to redo this lecture, I'm like, I should just brush up on this paper. And I'm going to tell you, it is not particularly intuitive. It's a very deep dive into the nuances of this. Yeah, everyone who knows this paper is like, yes, I know it. It's like you need to really concentrate to understand this. So I want to sort of throw out some of those constructs around the differences here, because really at the end of the day, what we need to know is what's the basis that forms the foundation for why we're doing something. So I want to encourage you to start with why, rather than getting caught up in is this a theoretical framework or a conceptual framework? Try to answer the question of why. Why did you do something in your paper? Why did you ask a question? Why did you use the methodology that you used? What theory informed the work that you did? So this is really just answering the why question. There's another fantastic paper here linked at the bottom, again by Bordage. It looks like it got cut off. It's from 2010, I believe. But a great paper by Bordage, and again, looking at conceptual frameworks, he has written quite a bit and is a fantastic writer. But a couple of different ways, again, that we can move out of that Varpio paper where it's very siloed into what's what, and thinking about it's how we look at a problem or a question, and a way to explain something that's complex. And we can use them for 3 things. So we can talk about the content, why did we choose specific content? Why did we choose specific methods? And then how did we interpret those findings? So with that overview of conceptual frameworks, I want to just introduce a couple of my kind of favorite go-to theories or conceptual frameworks that I've used throughout the years, both in curriculum design and teaching and in scholarship, that I think can really help inform what we do. So I just want to think about probably a common problem that we've all faced, which is a complication around a procedure. We have trainees that we're teaching to do procedures, and so your hospital might identify that your central line infection is too high, and so you're tasked with well, what do we do to fix this? And like all good medical educators, you decide not only will you design a curriculum to fix this, but then we should publish or present this somewhere, whether it's at a conference or as a paper. So I will say the two, Kimberly Shearts are left, there's two theories that I think are really nice at looking at how do we teach someone to do procedures, right? So I think that what happens often in orientation is you put a bunch of task trainers out and you turn them loose, and your interns loose into this room after watching a video, and you just tell them kind of practice doing central lines, and you walk around the room and supervise. So two ways that we could look at this. One would be mastery learning. We'll talk about multiple resource theory as well. But just again to give an application of how this looks. So I'm sure many of you are familiar with mastery learning, but it's this idea that we take a really rigorous approach to how we're teaching something. So it's a paradigm that says we have to have rigorous outcomes in order to ensure that we are meeting the objectives of whatever it is that we've designed. So that regardless of the time that it takes, at the end of a curriculum or a session, everyone reaches the same point. Sounds a little bit like CBME, right? Like we're not on a time base, you get an hour to do central lines, and then at the hour of central line practice, you're proficient. It's saying however long you need is the amount of time that you're gonna take to become proficient in central lines. So you can't just take a heterogeneous group of learners and apply the same curriculum to them because they all have different needs. So the process of learning is very standardized in mastery learning. So it's not that the teaching is standardized, it's the process that the learner goes through. And so, you start with this pretest. And in this pretest, someone, if I ask you to tie your shoe and that's your pretest, I suspect most of you would pass, and you would just go on, you would move on to whatever your next session was. But a more complex task, someone might miss steps. And so when they miss steps, that's the opportunity to provide teaching and then take them back through that process with the post-test, and either they get all of those steps correct or they don't, and they come back to the teaching and you reinforce all of those points that they missed. Barsick out of Northwestern applied this to central line teaching, and is probably one of the, again, kind of like landmark mastery teaching or mastery learning as applied to central line teaching. Fantastic example though, if you look at his paper, again, published broadly using mastery learning to address how do we reduce central line infections. Another interesting theory looking at how we can teach procedures is the multiple resource theory. This is used a lot. Most of the literature in medical education is around laparoscopic teaching for surgeons, but I think the principles really apply to all of the highly complex tasks that we do in emergency medicine. So this theory states that you can't you process information in two different ways and you respond to input in two different ways. You have different channels, right? You have auditory and then spatial or motor, and that's how you can input, and that's also how you output. So you can actually use multiple resource theory to evaluate the effectiveness of a curriculum that you have. So if you're trying to work on central line proficiency, you could have a checklist. But you could also start to make it more and more complex or add an additional stimuli to see how your learners are progressing in a procedural training. With the laparoscopic surgery, one of the studies looked at having learners perform a laparoscopic procedure on a trainer. They did that fine, and they started adding in more and more stimuli, not related to the laparoscopic procedure. So it might be in their visual field as they're doing the laparoscopic procedure, they see boxes and they have to identify whenever a red box pops up. So it starts to increase their cognitive workload so that then as they are doing their other procedure, they are becoming more proficient in that as they have a second task added, so that then when they are in the OR, in the operating field doing this, they actually were able to show that those learners that had the secondary task added were more proficient in this. So again, another way that we can look at a problem of our learners aren't doing a procedure correctly, how do we want to fix it? But then using theory to back up, this is why we did the study this way. One of my favorite, as a program director, for other program leadership, former program directors in the room, motivating our learners can be really challenging, and this is something that I struggle with sometimes, is how do I get my learners to be excited and motivated to do things that either they have to do, or that I want them to do, or that my chair wants them to do. So there's a couple different theories about motivation that I want to talk about. So when we talk about motivation, right, we have intrinsic and extrinsic motivation. The idea is that we really would like to move our learners from extrinsically motivated things, like you won't graduate unless you do research. You won't move on to your next year if you don't log your procedures, right? All of the sticks that we have, these extrinsic motivators that they do only to avoid consequences or to get a reward. To an intrinsic motivation, which is we know through a couple of different like theories and like Maslow's hierarchy, right? Like once we get to this more intrinsically motivated area, that's when we become these self-actualized humans that can really achieve our potential. So we'd love to move people as much as we can to the intrinsic motivation side of things. So self-determination theory really gets at how do we motivate our learners and how do we get our learners onto that intrinsic part of the spectrum. So there are three parts that play into, sorry about my wandering lonely tea there, but there's three parts that go into moving someone to be intrinsically motivated. And so basically we need three things. A learner needs to have competence, autonomy, and relatedness. And when we have these three components, we can then move them. So the first is competence. So do they have the skills to do the task that we are asking them to do? If I tell my interns, you need to write a peer-reviewed publication and have it published by the end of your residency or you won't graduate, I have to be able to provide them with all of the tools they need to do this. Most interns won't come in able to do this. So we have to give them the research boot camp, the skills days, the faculty available to help them. They also need to have some autonomy. So you need to feel like you need to give them the ability to choose what they want to do and feel like they have some ownership in the process that they're engaged in. Using the research example, so I can say, sepsis is really important. We need to do more research on sepsis. I want each one of you to do a project on sepsis. But if they didn't choose that and they're not interested in it, then again, you're going to lose that autonomy piece. So really, if you just say, I want you to choose a topic that you're passionate about, that you're excited about, find something that you want to wake up and work on in the morning, that piece of that autonomy will really help to move them towards intrinsic motivation. And then the final is relatedness, so feeling like you're part of a community. You guys have probably heard about communities of practice and how we're building these in the virtual setting. But really providing people with this feeling that they're part of something bigger, that they have other people with them. So creating little learning groups of like, you're going to work with this group of 5 people on this project and not siloing, can again really help move towards that intrinsically motivated learner. A couple different interesting places, again, where this comes up, because I know we're really focusing on scholarship. Using self-determination theory to talk about, like, how do we help along the medical education as we're teaching our residents to become more autonomous. So this is a great article that uses self-determination theory to talk about how do we find that balance between autonomy in our residents so that they become intrinsically motivated in learning and their educational process, but balancing that with the supervision that we need in education for patient safety. And then I think this is my last one I'll just talk about briefly. Again, I think most of us are familiar with cognitive load theory. And again, another one of my favorite theories that really applies well to a couple of different areas, and I'm going to show you how you can use this in scholarship as well and when you're trying to get published. So just as a reminder, we have this, the 3 parts of cognitive load, the 3 things that make up what it takes to learn. This is all part of that process of moving information from your working memory, through and processing it and storing it, and how do we do that? So that extraneous are really just the distractions that come from your, from the learning point, right? So it's like the noise in the room, the lights, the cold room that you're sitting in, the things that you can't really change. Those are the extraneous parts that are impacting your learner's ability to process the information you're giving them. The intrinsic part is really how hard is the task? How hard is the concept that you're trying to teach them? And this is going to vary from your learner, so you need to tailor to your learner so that you can balance that intrinsic. And then germane is actually the process of learning. So how much effort does it take for that learning to occur, right? So moving things from your working memory, organizing it into schemas, and moving it into your long-term memory. So that's like the work involved in learning. And so, sorry, my colors are a little bit off. So I just want to give these three examples, right? As you're designing your curriculum, thinking about, right, this top example here is a curriculum or a project or a learning topic that is too intense for your learner. It's too complex. So your learner in this top box here isn't learning. There's no room for that germane part of learning. There's no room for them to actually process what you're teaching them because that intrinsic load is too high. On the flip side, that middle box is something that's too simple, right? There's no learning that's happening. There's no need for that germane load because the task is very simple. And so they don't need to actually process or move anything from working or in a lot of these theories, learning comes from recreating schemas and how we organize information. And so in this situation, you don't need it. So really that sweet spot is that bottom one where we have just the right amount of complexity for our learner, that there's still room for that germane and that process of learning. I do want to talk about 3 different ways that you can impact this. These are more related to how you present things and how you teach things, and then I want to give an example of how this works for publishing. So we can work on decreasing extraneous load. Again, those are the distracting things about the learning. It's not the topic itself, but just the things that pull your learner's attention away from the topic at hand. One of these concepts is split attention. This is the idea that you shouldn't put 2 different related concepts that can't stand alone in 2 different parts of a visual. So this is an example. This image on your left here is an example of split attention, right? You can't look at A and know what that's pointing to without then reading below and seeing what A goes to, and that's a higher extraneous load. That's going to be a distractor for your learner. Whereas if you reorganize that on your right, that eliminates that split attention model so that your learner can just look exactly where they need to go and they're not jumping around to find different things. This happens a lot with slide design if you like print slides, but then you're also giving a presentation that can't stand alone with it. We can also work on managing intrinsic load. This probably brings back some PTSD for some people. But you know, we can't throw this up on a slide and start with this with someone who has no concept of asset-based management. And so really you need to break this apart into isolated elements. And so take it apart, break apart those more complex pieces so that your learner can then take it and then put it back together into one. There's a lot of evidence on how we remember things and how we learn things with chunking and how do we chunk information. And so again, this is part of that chunking concept that we're going to give them these pieces that as learners can become more adept with the information, they can chunk it together and create schemas. And then again, because this summit is about scholarship and we want to talk about how do we get things published. This is a nice paper from 2021, which actually talked about how do we use cognitive load theory to design videos for an online learning format. So again, double dipping, as we just heard, right? Publish, blog, speak, or in some order. But if you're doing a curricular development, implement it, study it, and then publish it, but you need to have that background for it. So this is a great paper. It's a really good read. So I think it's from 2021, JGME. I apologize, the full reference isn't on there. But take a look at that and see how someone uses something like cognitive load theory, which we've all talked about, used before, have some basic understanding of how can you use that to then promote and turn your scholarship into something that's publishable. And then as a partially shameless plug, I have no disclosures and I get no royalties, but the next step as you're trying to think about how can you learn more about education theory, how can you learn about applying application theory is the series of books that we publish for the faculty incubator. And so if you join the faculty incubator, you get to be a book chapter and eventual editor of a book. But this is a great series. It's free. It's available to you on Alium, Apple Books. That QR code will take you to the place where you can get it, but totally free to you. Lots of theories in each of these books that you can look at, either as a point of reference, so as you start a project, you're like, I don't even know what theory I could use to help describe this. You can turn to these references, Or if you read something like, I actually don't even know what multiple resource theory is, I'd like to learn more about it. Each of these chapters has a vignette about how this is applied to medical education or the medical field. And is a really nice starting point for you to better explore and better understand how we can use this. Okay, and so with that, happy to take any questions. You can feel free to email me. But again, I hope that this has given you at least a glimpse of how we can use theory, some of these potentially more abstract theories, and how we can really hone it and apply it to our education research. Thank you.